Hey guys, my name is Dr. Naisha Bonnet with Nurse Doc Tutoring Services. Today we will be going over tube feeding calculations. So, the two formulas that you need for today is the total volume formula, which is the total volume equals mLs in a can over X equals your strength. Then the other formula you need for your dilute is your total volume minus the can, and that will give you your dilute. So let's do an example. It says the patient is ordered Jevity 1.2 cows. You're supplied with a can of Jevity that contains 237 mLs of feeding formula. The doctor orders the tube feeding to be administered at a 2/3 strength with a rate of 50 mLs. What is the total volume and how much water will you need to add to dilute the tube feeding as prescribed? All right, so to get the total volume, first we're going to do the mLs in the can. So how many mLs is in the can? 237 over X, and the strength is 2/3. So we're then going to cross multiply. So 237 times 3 is 711 mLs, and 2 times X is 2X. So we're then going to isolate the X, so we're going to divide by 2. And we're going to get 356 mLs. All right, so that will give us our total volume. All right, so the next part of the question says, how much water will you add to dilute the tube feeding? All right, so our total volume minus what's in the can. So how much came in the can? 237. So we subtract that and we'll get 119 mLs. So we will need 119 mLs of water to dilute. All right, so let's say you got to the end of your problem and you just want to double check to make sure you're right. You should be able to add your dilute and your can together to get your total volume. Let's try another example. It says that the patient is ordered Jevity 1.2. You're supplied with a can of Jevity that contains 237 mLs of feeding formula. The doctor orders the tube feeding to be administered at a 1/4 strength with a rate of 60 mLs per hour. What is the total volume administered, and how much water will you need to add to dilute the tube feeding as prescribed? All right, so we're going to go ahead and set it up the same way. So how many mLs are in the can? 237 over X. And our strength for this problem is 1/4. So we then going to cross multiply. 237 times 4 is 948. 1 times X is 1X. So we want to isolate our X. So we're going to divide by 1. So our total volume here is 948 mLs. All right, so we got our first part of the question. So now we're going to need to figure out how much water will we need to add to dilute it. So we have our total volume here. So how much comes in our can? 237. So then we're going to subtract 948 from 237, and we're going to get 711. So we would need 711 mLs of water in order to dilute this. All right, so let's move on to a different type of tube feeding question. We're going to switch gears to another type of tube feeding question. So this one will focus on how long it will take to actually finish the tube feeding order. All right, so it says that the MD orders Glucerna via the patient's NG tube. The formula is to be administered at a half strength with a rate of 50 mLs per hour. You are supplied with 237 ml can of Glucerna. How long will it take to administer this feeding as prescribed? All right, so we first need our total volume, And then once we get our total volume, we're going to set it up to be over mLs per hour. All right, so let's get our total volume. So the question says how many mLs is in the can? 237 mLs is in the can. And our strength is what? 1/2. So we then go cross multiply. So we get 474 mLs equals 1x. All right, so we're going to go ahead and isolate our x by dividing by 1. And our total volume would be 474 mLs. All right, so now let's go a step further. So we're going to take our total volume, 474 mLs, and we're going to set it up. All right, so milliliters need to be on the bottom in order for milliliters to cancel out, and that's part of dimensional analysis, right? So what does the question say? The question, how many mLs over an hour? So it says it's 50, and we put 1 hour. So our milliliters cancel out. So we're going to divide 474 divided by 50, and we're going to get 474 divided by 50, we're going to get 9.48. All right, so we're going to be hours. All right, so what is 9.48 hours? We don't know what that is, but we know it's 9 hours and some change, right? So we need to convert this part right here, our 0.48, to actually hours to minutes, right? So 0.48 hours. So dimensional analysis, we going from hours to minutes. So hours goes on the bottom. 1 hour equals 60 minutes. Hours then cancel out. So we're going to multiply 0.48 times 60. And we're going to get 28.8. All right, we're going to round to the nearest whole number, so that's 29. So we're going to not forget about this part up here. So we're 9 hours and 29 minutes. All right, so let's try another one. Let's try another one. So the next problem is the MD orders glucerna via the patient's NG tube. The formula is administered at 1/4 strength with a rate of 75 mLs per hour. You are supplied with a 237 can of glucerna. How long will it take to administer this feeding as prescribed? So first, we know we have to get our total volume. So how many mLs is in the can? 237. Over x, and our strength we're going to be dealing with is 1/4. All right, we then do our cross multiplication, and we get 948 mLs over 1x. All right, so we then going to isolate our x and just divide it by 1, and our total volume is 948 mLs. All right, so we then are going to go back to our problem to get our infusion rate. So our mLs per hour. So we say that it's at 75 mLs per hour. So 75 is going to go on the bottom, and hour is going to go at the top, just 1 hour. So the mLs are going to cancel out, and let's do some math. So 948 times 1 is 948, and then 948 divided by 75 will give us 12.64. All right, so we know we can't use that 0.64. We got to take that 0.64 and turn it into minutes. So 0.64 hours over 60 minutes equal 1 hour. So the hours cancel out, and then we're going to multiply straight through. So 0.64 times 60 would give us 38.4. We're going to round to the nearest whole number. It's not greater than 5, so it stays at 38. So we go back here. Can't forget our 12. So we're then going to be at 12 hours and 38 minutes. I hope this lecture made understanding two-feed calculations just a little bit easier. If you do have any extra questions, please leave them in the comment. I want to thank you guys so much for watching today's lesson, and I hope you learned a lot. Continue to study. Have a great day. Do you think that we will make a great fit? Contact me. I would love to be your personal